Hi, good afternoon. Dr. Richie Smith here. I wanted to do a quick video just talking about pediatric flatfoot and what we look for and what we see, and kind of explain what that all entails. So you could always reference back to it if you think your child may have a flatfoot that could possibly be causing them pain. Oftentimes when we get a little pediatric patient in here, they don't always have pain in their foot. They oftentimes complain of pain in their knees and even possibly in their hips. But oftentimes that's coming from a problem with the foot itself. And so I just kind of wanted to go over this with you guys and share my knowledge with you. I have my daughter here today, Haley. She actually has a flat foot. And so we're just going to take a look at kind of what we look at here in the clinic. So the first thing we take a look at is her ankle joint range of motion. When you have a flat foot, you have a reduction in motion in your ankle joint. So when we go to move the ankle up, you can't get as far in an upward motion or dorsiflex motion as you should. If we bend her knee here, so that's where normal is. That's where she should be. If you can see with her knee straight, we can't get there. She's limited on her motion. Oftentimes when we have patients that have a flat foot, they have pain in this area here, and this is due to the subtalar joint. That's the joint that's right beneath the ankle joint, and that's where the dislocation is occurring at. And so oftentimes they may have pain in here. They may also have pain along the inside of the ankle, and this is along a ligament called the a tendon called the posterior tibial tendon. That tendon runs behind the inside portion of the ankle, and it comes down and attaches to a bone here on the foot called the navicular. Yeah. Okay, so you can see here when Haley stands up, these black lines that we've drawn, they don't line up. In a normal foot, you should see this bisector of the leg go right through the center portion of the heel. Well, her center of the portion of her heel is over here. Same way on this side, that center portion of the leg should go right through the center portion of the heel, and you can see that it does not. If we perform a maneuver called a Hoopshire maneuver, don't help me, Haley. We bring the big toe up. As we do this, the heel bone corrects itself. So that's normal. That's where she should be. If we look at this side, don't help me, Haley. That's normal. That's where she should be sitting at. You can see when we let go of the big toe, her subtalar joint collapses inward, the talus comes inward, and we get this medial bulge on the inside of the ankle here. Okay, you can stop it, Chloe. So when we're evaluating a pediatric flatfoot, we obviously want to take some x-rays and evaluate the structure of the foot. We are also looking for any pathological issues as well, like fractures. When we are doing these x-rays, they're done load bearing, so the patient's weight bearing, and they're in their angle and base of gait. When we look at this bone here is called the calcaneus, otherwise known as the heel bone. This bone here is called the talus. This is the navicular, and this bone hiding back here is called the cuboid. Your heel bone should be 35 degrees off the bottom of the foot. Well, you can see in this patient's x-rays, the heel bone is almost parallel with the bottom of the foot. The talus here, when we bisect it or cut it in half, you should see it sit and run right through this big toe joint. Well, you can see in this patient's x-rays that the talus is coming out the bottom of the foot. The talonavicular joint and the calcaneal cuboid joint should match up and make a nice S shape. But you can see here we have to pick the pointer up and move it in order to catch that joint. When we're looking at a straight down view or an AP view of the foot, again, this is our talus here. This is the calcaneus or the heel bone. This bone here is the cuboid, and this is the navicular. When we bisect that talus once again, you should see it go right through the big toe. But what we're seeing in a pediatric flatfoot is that the talus falls well outside the level of the foot. The calcaneal cuboid joint should make a straight line, and you can see here how it's angled. The talonavicular joint, the navicular should fully cover the head of the talus. But you can see here how there's a good half of the talar head that's not covered. All of these signs are just pointing to a dislocated subtalar joint. So in the pediatric flatfoot, what we see is this Achilles tendon is short and tight. When this tendon is short and tight, it pulls against the back of the heel bone, collapsing that heel bone down. So what we see, this is a foot bone. This is a normal structure to our foot. This is how the foot should look. When the Achilles tendon is short and tight and it runs back along the back of the heel bone and attaches back onto the back of the heel bone here, and when it's short and tight, it pulls against the back of that heel bone, collapsing that heel bone down. As that heel bone collapses down, the talus, which should sit up on the calcaneus, now slips off and points downward. So looking at it from another view, from this side, Achilles tendon attaches back here, it's short and tight, it pulls against the heel bone, collapsing the heel bone down, causing the talus to slip off and point downward. And then that causes a dislocation of the rest of the foot. When you look at the talonavicular joint, it sort of acts like a ball and socket joint. It should sit in and of itself like this, and the joint moves from side to side. When we see a pediatric flatfoot, what happens is the talus has dislocated off the subtalar joint, and it now points outward, being uncovered from the navicular. So let's just quickly go over a flatfoot and what's going on when you have a flatfoot. So the primary deforming force in any flatfoot, and a pediatric flatfoot's no different, is this Achilles tendon is short and tight. When this tendon is short and tight, it pulls against the back of the heel bone here, collapsing the heel bone down. That's going to cause a dislocation along this joint here called the subtalar joint. That's the joint that's right beneath the ankle joint. Because that tendon is short and tight, and it's pulling against the back of the heel bone and collapsing that heel bone down, and the subtalar joint is dislocating, your feet look like this upon stance. The Achilles tendon has a normal passive pull against the heel bone. That passive pull is meant to help hold the foot up and in. Well, when that tendon is short and tight, it shifts its pull, and now it pulls the foot in a further flattened position. That causes these tendons and ligaments that sit on the inside of the ankle joint to now get put under stretch and strain, and it can also weaken them. It allows these tendons, called your peroneal tendons that sit on the outside of the foot, to gain mechanical advantage and continue to pull that foot out into a flattened position. This tendon here, the posterior tibial tendon, its main job is to hold that foot up and in. Well, once the Achilles tendon has caused the flattening of the calcaneus, the peroneal tendons have now gained mechanical advantage and taken over, this tendon can become weakened and again can be put under stress and strain, become inflamed and painful. So you can see that this problem is a progressive problem. It's not one that's going to spontaneously change, especially once the child reaches about the ages of 5 to 8. You're going to continue just to see the subtalar joint further pronate, the heel bone further collapse due to what's occurring with these tendons here and how the shift in the pull has occurred. Thank you so much for watching our video today. I really do appreciate it. If you have any questions about your child or someone in your family who you are concerned may have an overpronated foot type, you can place those down in the comment section below, and I will try to get back to you quickly with those answers. Again, if you do think you have a child that may have an overpronated foot or is complaining of some foot or knee pain, get them in here. We've got our x-ray machine up and running. We'll take some x-rays and look at the structure of their foot and discuss what may be going on and what we can do to help. Again, I just want to say I appreciate all of my patients and all you guys out there and how truly blessed we've been, and thanks again.